Good morning. The topic for today's discussion is gingiva. Before we get on to the definition of gingiva, oral cavity. Oral cavity can be divided into vestibulum oris and cavum oris proprium. So mainly there are two parts of dividing the oral cavity into two parts, that is vestibulum and the oral cavity proper. So that thus there is no need of differentiating between the buccal and labial, case eliminated. So oral is described as the palatal, the lingual part. Vestibular describe those surfaces that face the vestibule, and vestibular cavity is bounded anterolateral by the mucous membrane of lips and cheeks and internally by teeth and gingiva. Oral cavity proper is bounded anterolaterally by teeth and gingiva and superiorly by palate, inferiorly by tongue and floor of the mouth, and posteriorly by pillars of fauces. This is a pictorial representation of the oral cavity proper and the vestibule. So they have reflected the lips to show the vestibule. So that's highlighted over there. And the down the picture shows the vestibule, and the right side picture shows the oral cavity proper, and the parts of the oral mucosa and the oral cavity is labeled over here. The first slide, that is the gingiva. What is gingiva? It is that part of the oral mucosa that covers the alveolar process of the jaws and surround the necks of the teeth. Gingiva is an example for the mastication mucosa, and this is a keratinized mucosa and parakeratized mucosa. So it extends from the dentogingival junction to the alveolar mucosa. So the morphology of the epithelium and the connective tissue is designed so that it can be, and it helps in the adaptation to the masticatory forces, and it is adapted to by the friction and as we said earlier, the masticatory process. Most of the cases it is parakeratized, that is 75% of the cases the gingiva is parakeratized. In 15% of the cases it is keratinized, and 10% of the cases it is not keratinized. So below the epithelium we can see a lamina propria, which is dense, and the collagen fibers insert into the alveolar bone or cementum or blend with the periosteum. So the submucosa is absent over here. The lamina propria is directly attached to the periosteum underlying bone. So that type of attachment is called as mucoperiosteum attachment. So that is why we said earlier, the morphology of the epithelium and the connective tissue is meant to adapt to the masticatory forces. The mucogingival junction, there is a junction that separates the gingiva and the alveolar mucosa. The color of the gingiva, it depends on the keratinization, thickness of the epithelium, pigmentation, and the presence of the blood vessels. The blood vessels are higherly placed, then the color is becomes more pinker, deep pink in color. The gingiva can be divided into macroscopically and microscopic parts of the gingiva. Mainly macroscopically, we can divide the gingiva into free gingiva, attached gingiva, and interdental papilla. So this picture shows the parts of the gingiva. It shows the dotted line shows the marginal gingiva, and the area between the marginal gingiva and the mucosa, that is alveolar mucosa, shows the attached gingiva. So we can see the color variation there over here. Attached gingiva shows a paler pink, and the mucosa, alveolar mucosa, shows a deeper pink color, reddish you can say. And below the picture shows all parts of the gingiva. It is labeled so you can make out there is a free gingival groove, the marginal gingiva, here a free gingiva. The free gingival crest is the alveolar mucosa, which is deeper in color. Mucogingival junction, the junction that is between the alveolar mucosa and the attached gingiva. Interdental papilla, and the sulcus, which is not seen over here, but you can see the sulcular epithelium. The interdental papilla, sorry. Alveolar mucosa, mucogingival junction, attached gingiva, marginal gingiva, interdental gingiva, and so already we studied mucogingival junction. Now what is free gingival groove? So the free gingival groove, that is the dividing line that is between the free gingiva and the attached gingiva. It runs parallel to the gingival margin at a 0.5 to 1.5 mm. And it is a V-shape, it shows a V-shaped notch and the heavy epithelial ridge in the histological sections. And at or apical to the bottom of the gingival sulcus, you can see the free gingival groove. And we say that it is a functional impact. It is caused by a functional impact to the free gingival groove and epithelial ridge. It is a result of the functional impact that is caused by the masticatory process. If there is no free gingiva, then that means the sulcus also will not be present. That is again a picture shows the parts of the gingiva. You can see the margin gingiva over here, which is again shown as a white line below that. You can see the margin gingiva, the other free gingiva, the gingiva, mucogingival junction, and the alveolar mucosa. What is attached gingiva? Attached gingiva, as we said earlier, is the area between the alveolar mucosa and the marginal gingiva. You can see that gingiva, and it is paler pink in color. And the characteristic feature of attached gingiva is stippling. So you can see elevations and depressions on the gingiva. So if you rub the gingiva with the dry cotton, you can see all these elevations and the shallow depressions. So what does this depressions indicate? They correspond, this depression correspond to the center of the heavier epithelial pegs. And this again is considered, stippling is considered to be functional adaptation, which again withstand masticated mechanical forces. So if the stippling is present, that means the gingiva is healthy. So in case of edematous gingiva, a condition called gingivitis, in that case the absence of stippling will be noted. What are the other variations we can see is that between males and gender variation is that males the stippling is seen more, and females, and the other thing is noted is nuclei contain a large chromatin particle near the nuclear membrane. So these are the variations we see in the attached gingiva. We have the cell of the attached gingiva. Interdental grooves. What are interdental grooves? So these are the depressions between the adjacent teeth. We show vertical folds. So that is known as interdental grooves. So gingiva is slightly, that is depressed between the adjacent teeth. So this corresponding depression on the alveolar process between the eminences of the alveolar sockets. So these depressions are seen as vertical folds, and these vertical folds are called as interdental grooves. Now, so attached gingiva, the maxilla and mandible, the variation, the width of the incisor area is 3.5 to 4.5 mm, and towards the molars it is 1.9 mm. In mandible it is 3.3 and 3.9 mm, and the posterior area is 1.8. Interdental papilla. Again, this is a part of gingiva. So as we studied already, attached gingiva. Again, there are three parts of the gingiva: attached gingiva, marginal gingiva, and interdental papilla. So interdental papilla is that part of the gingiva that fills in the space between the adjacent teeth. So the part of the gingiva, the interdental papilla, it appears actually triangular from the oral as well as the vertical vestibular aspect. In the 3D view, it can be viewed as a tent sheet. In posterior view, you will see it as a tent sheet, and when you see in the anterior view, it is more pyramidal shape. So, what is the other feature of the peculiarity of the interdental papilla is the presence of caul. Why is it important? Is because it is lined by a non-keratinized epithelium, as well as it is vulnerable for the infection. So what is caul? It is a concave area in the center which fits between the contact area. So that area is called as caul, and it is lined by a thin non-keratinized epithelium. So it is vulnerable to periodontal disease. That is the reason we call it as an important part of the interdental papilla. So when the interdental papilla is a tent shaped, the oral and vestibular corners are high, as you can see in this picture. So whereas the central part, you can see it as a depression, a concave depression is seen. So this area fits below the contact area, and this depressed part is called as caul. This line by non-keratinized epithelium. Here there is another picture which shows this depression that is indicating the caul. Now coming to the macroscopic features. So we finished the macroscopic features, getting on to the microscopic features. So gingival epithelium, as we said, some parts of the gingiva is non-keratinized and some parts are keratinized. So mainly, broadly, we can say that there is an oral epithelium, subclavian epithelium, and a junction epithelium. Histologically, if you see the type of epithelium, it is the gingiva is lined by a stratified squamous epithelium, and there are 4 layers, that is stratum basis, spinosus, granulosum, and stratum corneum. Stratum basal is also known as the basal line, stratum spinosum, the pectoral line, granulosum, the granular line, corneum, the cornified line. The type of keratinization, the mucosal surface results from the formation formation of the surface layer of keratin, which is formed by a process of maturation, is called as keratinization. Yeah, it is also called as cornification. So the keratinized epithelium has got 4 layers: stratum basal, stratum spinosum, stratum granulosum, and stratum corneum. Stratum basal is a single layer of the pupil or corneal cells adjacent to the basal lamina. The basal cells are synthesized at angle and undergo mitosis and provide for cells. Some spinal cells just beyond the basal layer also shows the mitotic fibers. So these subbasal and the parabasal spinal cells together is called as stratum germinativum. Basal cells also show ribosomes, rough endoplasmic reticulum, and it also that is helping in the protein synthesis. So the protein for the basal membrane and the protein which form the intermediate filaments are formed. There are 2 populations in the basal cells, one is serrated cells and another one is non-serrated cells. The serrated cells are a single layer of cuboid or bicuboid cells and it is heavily packed with filaments. And it has got protoplasmic processes that is called as pedicles. They project from the basal surface towards the connective tissue, and this is an adaptation for attachment. So this picture shows the 2 types of cells, the serrated as well as the non-serrated cells. The serrated cells are seen at the epithelial ridge and the connective tissue papilla area, and the deeper portion of the papilla is lined by the non-serrated cells. Yeah, they are also the stem cells. The second type of cells which is seen in the basal layer is the non-serrated cells, and they are slowly cycling stem cells, and they can be either slowly dividing stem cells or amplifying cells. Slowly dividing cells which preserve the genetic information, and amplifying cells which increase the number of cells for maturation. And these cells are attached to the basal membrane by hemidesmosome. So the cells are the clot-like attachment which is seen, which attaches the basal cells towards the basal membrane are called as hemidesmosome. But the lateral borders of the cells are attached by desmosome. So it has got transmembrane proteins and cytoplasmic proteins. The transmembrane proteins which you see are desmoglins and desmocollins, and the cytoplasmic proteins are desmoplakin, plakoglobin, plakophilins, and periplakin. And occasionally you can see other junctions also. Gap junctions and tight junctions. Tight junctions are absent. Stratum spinosum, that is seen in the above basal layer. Yeah, the layer seen above the basal layer, basal cells are called as stratum spinosum. Yeah, the spinal cells. Several rows of large or irregular polyhedral cells will be seen. It is also called as prickle cell layer. So basal plus the prickle cell layer together forms a 2/3 of the thickness of the epithelium. Under light microscope, these cells are joined by intercellular bridges, and it is also caused by tonic bridges. Electron microscopically, you can see intercellular bridges are these intercellular bridges are desmosomes, and actually there is presence of tonic bridges also. Intercellular spaces of the spinous layer of the keratinized epithelium are large and distinctive. But in case of a non-keratinized epithelium, the intercellular spaces are not that large. The spinous appearance, spiny appearance, and the prickly appearance of the cell is because of the shrinkage of the cells during the tissue preparation, causing them to separate from the points where the desmosome do not anchor them together. So this gives appearance, that prickly appearance. Yeah, that is the reason it is called as spinous. Spinous cells are the most active cells in the protein synthesis. Hemidesmosomes, as we mentioned in the basal layer, are more in the basal cells of the gingiva and hard bulk than the alveolar mucosa. The other, the lining mucosa, and a monoclonal antibody to desmoplakin and plakoglobin can be used to detect the spinal fluorescent microscopy. The next layer above stratum spinosum is stratum granulosum. Larger flattened cells contain small granules called as granules. So this granules you can see in the picture on the right side. These are basophilic, and the nuclei also shows degeneration and necrosis. So that is electron microscopic view of the keratinoid granule. As the cells approach the stratum corneum, the rate of the protein synthesis diminishes. Tonifilaments are more dense and mostly associated with keratinoid granules. Lignin and trichohyalin are differentiation markers of keratinocytes associated with the keratin cytoskeleton during the term differentiation. Calcium and keratinoids influence the differentiation by altering the transcription of target genes, regulating the activity of enzymes critical in differentiation, example transglutaminase, proteinases, and protein kinase, etc. Cell surface becomes more regular and more closely affected than adjacent cells. There is a membrane coating granule or a laminated granule which will be seen that are called as keratinocytes or gland bodies. So these are seen in the upper layers and small membrane bound structures. This actually contains glycolipids, and this is either an elongated or a round lamellated body. So the elongated one is seen, the lamellated body is seen in the keratinized epithelium, and the spherical one is seen in the non-keratinized epithelium. So the main function is that it secretes the glycolipids into the intercellular spaces, and this actually prevents the penetration. So lamella granules discharge their contents into the intercellular spaces, forming an intercellular permeability barrier. So this barrier at the junction of the granule and the quantified layers. So at the same time, inner unit of the cellular membrane also thickens, forming a quantified cell envelope. So in keratinized, it is elongated and lamellar, as I mentioned earlier, and non-keratinized, it is circular and amorphous. This is a picture, electron microscopic view of outline body. It is more elongated on the left side picture, and it is more circular in the right side one. So the longer elongated one is seen in the keratinized epithelium, and the spherical one is seen in the non-keratinized epithelium. Stratum corneum, near the body line, flatter squamous cells is present, and it is it stains bright pink radiosum. No nuclei or other organelles are seen. Histologically, it is amorphous. Electron microscopically, dense packed filaments develop from the drawn filaments in interfilamentous matrix protein filature. So this filature is derived from a precursor protein. The cross-linking of the drawn filaments by disulfide bonds gives the mechanical and chemical resistance. Keratinized cells are formed and dehydrated and covers a larger surface area. We do not synthesize protein. It is closely applied to the adjacent square, and cell surface and elasmosomes are altered. Cell membrane is thicker and denser. So that is parakeratinized and epithelium, which shows a gingiva. It is reaching the hypnotic and condensed membrane, and others are partially lysed or organized. There's keratohyalin granules and the granule lines, so it is difficult to recognize. It is a normal process, and the parts of the palate and the gingiva are like parakeratinized epithelium. This is a picture showing the test tube shaped reticulates of a gingiva is long, and the parakeratinized epithelium is not oblique, and below the lamina propria. The lamina propria is a dense connective tissue, and sometimes inflammatory cells like lymphocytes, plasma cells, and macrophages will be noted. Long, slender, and numerous connective tissue background, and the inflammatory cells are more to the cell since it is a mastocytoid mucosa, and presence of few elastic fibers, and the type of attachment of lamina propria to the underlying bone is called as a mucomuscular attachment. The mucogingival junction, that is a junction between the gingiva and the mucosa. You can see a slight indentation between the indentation that is called as the mucogingival groove, which is not over here. So change from a bright pink color to a pink, and attached gingiva is a pale pink color. So what are the differences between attached gingiva and mucosa? Attached gingiva is keratinized, it is stippled, contains deep reticulates and thick lamina propria, contains very few elastic fibers, indistinct as of mucosa, and it is firmly attached. In case of angular mucosa, it is not keratinized. It is unstippled. It contains a short, wide reticulates, thin lamina propria, numerous elastic fibers, and distinct submucosa, and it is mobile. So we studied about the gingiva, the macroscopic and the microscopic features of your gingiva, and the difference between the attached gingiva and the angular mucosa.